Maternity Nursing MCQ. The normal duration of pregnancy is 40 weeks. The first stage of labor begins with onset of true labor pains. The second stage of labor ends with birth of the baby. The third stage of labor involves separation and expulsion of placenta. The fourth stage of labor is approximately first 1 to 2 hours after delivery. The normal fetal heart rate is 110 to 160 BPM. The most common fetal presentation at term is vertex. The hormone mainly responsible for maintaining pregnancy is progesterone. Oxytocin is mainly responsible for uterine contractions. The hormone responsible for milk production is prolactin. The hormone responsible for milk ejection is oxytocin. Colostrum is first thick yellowish breast secretion. The first antenatal visit should ideally occur as early as possible. A positive sign of pregnancy is fetal heart activity. The average blood loss during vaginal delivery is approximately 500 ml. Postpartum hemorrhage after vaginal birth is traditionally defined as blood loss of 500 ml. The most common cause of postpartum hemorrhage uterine atony. The first-line uterotonic commonly used to treat uterine atony is oxytocin. Preeclampsia is characterized by hypertension after 20 weeks. A severe complication of preeclampsia characterized by seizures is eclampsia. The drug of choice for prevention and treatment of eclamptic seizures is magnesium sulfate. An important sign of magnesium sulfate toxicity is loss of deep tendon reflexes. The antidote for magnesium sulfate toxicity is calcium gluconate. Placenta previa commonly presents with painless vaginal bleeding. Abruptio placentae commonly presents with painful vaginal bleeding with uterine tenderness. The normal position of the uterus after delivery is assessed by checking the fundus. Immediately after delivery, a boggy uterus suggests uterine atony. The first milk produced after delivery is called colostrum. Exclusive breastfeeding is recommended for approximately 6 months. The APGAR score is usually assessed at 1 and 5 minu, which is not a component of the APGAR score. Blood pressure. The maximum APGAR score is 10. A newborn's normal respiratory rate is approximately 30 to 60 min. The normal heart rate of a newborn is approximately 100 to 160 bpm. Vitamin K is routinely given to newborns mainly to prevent hemorrhagic disease bleeding due to vitamin K deficiency. The best method to prevent heat loss in a newborn immediately after birth is drying and keeping the baby warm. The soft spot on the top of the newborn's head is the anterior fontanelle. The anterior fontanelle is generally diamond-shaped. The first stage of labor is divided into latent and active phases. Cervical dilatation during labor progresses from 0 to 10 centimeters. Full cervical dilatation. 10 centimeters. Engagement means biparietal diameter passes through the pelvic inlet. The most common fetal position. Left occipito-anterior. The first fetal movement felt by the mother is called quickening. Common presumptive sign of pregnancy is amenorrhea. The puerperium generally lasts about 6 weeks. Lochia rubra usually occurs during the first few days after delivery. Lochia alba is usually whitish or yellowish. Kangaroo mother care is especially beneficial for low birth weight babies. The best position for a breastfeeding mother and baby is one that provides good attachment and comfortable positioning. Like, share, and subscribe for more videos.